Hi, I'm Dr. Ben Lahood, ophthalmologist, cataract and refractive surgeon from Adelaide, Australia. Today I'm going to give you a simple explanation of PRK surface laser. At the end of the video, I'll give you my contact details and you're welcome to get in touch. PRK, or photorefractive keratectomy, is a laser vision correction technique that I use to treat short-sightedness and astigmatism. It is a very safe and effective technique. Next, I will draw you some diagrams to explain how PRK works and a video of the PRK process.
Here is a cross-section of the eye, with the cornea to the left of your screen and the optic nerve heading back to the brain on your right. Just behind the cornea lies the iris, or coloured part of the eye, and behind this is the crystalline lens, which later in life turns into a cataract. The lens capsule is held in place by zonules, holding on to the ciliary body. Today we will be concerning ourselves with the front surface of the eye, the cornea. As light rays enter the eye in an emmetropic eye, they are focused on the retina to give a nice, clear, crisp image. In a long-sighted eye, the eyeball is relatively short and the light rays are focused behind the eye, giving a blurry image for both near and distant objects. In a short-sighted eye, the eye is relatively long, and so light rays are focused in front of the retina. This produces a blurry image when the light rays do reach the retina. Concentrating on the cornea at the front of the eye, highlighted in yellow, if we look at this in cross-section, the whole idea with PRK is to make the surface of the cornea less steep. So laser rays are focused onto the cornea anterior surface and they take some of that surface away to make the front surface less steep.
At my clinic at Ashford Advanced Eye Care, I have the ability to perform transepithelial, topographically guided PRK. I will now explain what those terms mean.
Looking at a cross-section of the eye, traditionally PRK was performed by removing the top epithelial layer in green using either alcohol or physical debridement before laser was applied to the stroma to reshape the cornea. If we again look at a cross-section of the cornea, with pink representing the endothelium, blue the corneal stroma, and green the superficial epithelium, we now have the ability to perform transepithelial PRK, where nothing touches your eye, but the laser is applied directly to the surface epithelium, and this ablates down to the stroma to reshape the eye. This gives a nice clean edge, and in my experience, is a little bit more comfortable for recovery. You'll see that this surface is mildly irregular. We can use topographically guided treatments to map this shape and use the laser to give a more regular shape and hopefully better visual acuity. Regardless of the technique, the corneal epithelium heals underneath a bandaged contact lens, which is removed around day 4 before the cornea is allowed to remodel and become smooth to give nice clear vision. This video shows the whole process of PRK. The patient is fixing on the target, and the fluorescing light indicates that the laser is ablating through the corneal epithelium. You'll begin to see that in the center there is a lack of fluorescence where the laser is now hitting the stroma to do the real reshaping of the treatment. This whole treatment takes around 30 seconds. That would be typical for a transepithelial PRK treatment.
Thank you for watching, and I hope that helped explain how PRK works and how it may be used to improve your vision. You are more than welcome to contact me to ask any questions or to make an appointment. Thank you.